Well, thank you, and good afternoon to everybody who's on this webinar. Seth, can you hear me all right?
Yes, you can.
Okay, thank you. So again, this is extremely important on the Council of Quality Leadership Network Accreditation. And our goal today is to describe for you what that really means, and more importantly, why this is so important to the shared vision of the people with developmental disabilities to have full lives in the community. Next slide, please. Now, as a community, we've been on this journey together to design a system of community supports for people and their families that are truly flexible and provide opportunities for all. While I know this change hasn't been easy, I am really proud of the Maryland DD community who have guided the progress towards person-centered excellence. If you recall, this journey began with your partnership in response to my call for action in 2015. And since that time, we've worked together to build on what works really well for Marylanders and to change what needs to work better to help people and their families so that they can achieve their goals of personal vision for a quote unquote good life. And so bringing in the Charting the Life course, and many of you are aware of that, and the Maryland Community of Practice for Supporting Families has helped us to better build support for people and families to communicate their ideas, their goals, challenges, navigate through options, advocate for support that they need and want to reach their goals. So these approaches are foundational to our vision. They support the changes we've made in the way we provide case management, which will continue to guide our coordinators of community services today. They also led to the redesign of our waivers, our community pathways waiver, the community support waiver, and our family support waiver, to add new services to best support the people to use and access services differently and more flexibility. And we did this as a result of the feedback that we received to be responsive to the needs of the DD community. And as a result, because of this, we've pursued self-direction as an option, and our providers are finding new innovations also. So we see these as positive outcomes and are excited about the opportunities as an employment first, and as you know, just recently, a technology first state. So reflecting on all our progress and our partnership, it's important, but what's most important is understanding how and where this is making a difference to each of you. You know, our journey to person-centered excellence must also include the way for our service and support systems, more importantly, in real time, to collaborate, access, and respond to what's working well and what needs to work better. This is quality, and this is the focus of today's webinar. So I'm pleased to introduce the Council of Quality Leadership to build on our commitment to quality through network accreditation. Thank you.
Thank you. So since 1969, CQL, the Council on Quality and Leadership, has been a leader in working with human service organizations and systems to continuously define, measure, and improve quality of life and quality of services for youth, adults, and older adults with intellectual and developmental disabilities and psychiatric disabilities. CQL offers accreditation, training, certification, research, and consultation services to agencies that share our vision of dignity, opportunity, and community for all people. More than 380 organizations have achieved CQL accreditation throughout 25 states in the US, Canada, Ireland, and New Zealand. Broadly, the concept of accreditation involves the formal recognition of an organization for attaining a specific set of standards. It offers organizations the ability to seek out a higher level of quality in comparison to similar entities by allowing an external review of policies, procedures, practices, and more. Depending on the state, accreditation can sometimes be a requirement or recommended. So why is it important? Through an open, honest, and unbiased evaluation by outside experts, accreditation equips organizations with valuable information and action steps for improvement. When organizations rely on their own internal review of operations, they may unintentionally allow the investment they have in their organization to influence their outlook. Internal review also limits an organization to its pre-existing base of knowledge and insight, whereas accreditation aggregates best practices from other organizations. There are many values and benefits to CQL accreditation. Some of them include positive impact on people, improved services, external validation, like we talked about, accountability for progress, strategic planning, lots of data, as we will talk about towards the end of this webinar, alignment of values, resource sharing, personal outcome measures, appreciative inquiry, and positive impact on the workforce. Now, the CQL difference, our process isn't focused on paper, it's focused on people. Along with reviewing organizational policies and procedures, CQL uses proprietary and trademark tools to ensure that those policies are actually playing out in agency supports, and more importantly, in the lives of people receiving those supports. The accreditation experience with CQL doesn't begin and end with an on-site visit. CQL embraces a valued partnership with those who have achieved CQL accreditation throughout the entire accreditation term. CQL offers ongoing support, guidance, resources, check-ins, and insight for the organizations that we work with. CQL's quality enhancement specialists have diverse areas of expertise and work with hundreds of organizations across the globe. They bring best practices they have witnessed at other agencies and share how they can be implemented at your organization. The scope of other accrediting bodies can be limiting. CQL does not provide programmatic level accreditation of specific service areas. Our accreditation encompasses an entire organization, as true transformation is predicated on change at all levels. All stakeholders take on an important role in the accreditation as its effects impact each and every person connected to the agency. Now, CQL accreditation is not a deficiency-driven process. We work with organizations to help improve supports and services by discovering areas of excellence and areas of improvement. We work with organizations to apply lessons learned from the strongest aspects of the organization and apply them to spots where growth is needed. And lastly, organizations that partner with CQL use data collected through our proprietary tools to inform their decision-making and assess the return on their investments. If an organization is evaluating the effectiveness of a recent initiative or planning for a new one in the future, they can turn to evidence-based information and analyze data for planning and monitoring purposes. The information gathered and data collected can also be used at the individual level in creating person-centered plans and tracking progress. Now, again, CQL difference. Organization-wide accreditation is more meaningful. It leads to best practices being embraced at all levels for all services across an entire agency. Accreditation alone can have value, but the inability to assess and analyze it is limiting in determining success. So data capabilities are integrated into accreditation. And aside from just data, agencies often take advantage of CQL training, certification, and ongoing consultation. And we love to use appreciative inquiry as it helps to replicate success. This concept identifies pockets of excellence and lays out how those successes can be utilized in areas of improvement. Some of our proprietary tools include basic assurances, personal outcome measures, shared values, and community life. Now, basic assurances ensure accountabilities for fundamental and non-negotiable requirements for all service providers. This is not specific to reporting on performance with the waiver assurances. Okay. Personal outcome measures are used to identify people's quality of life outcomes, supports, and gather information and data about individual outcomes. Shared values look at the alignment of mission, vision, and values within an organization. And community life looks at relationship building that is done between people and their communities. In the state of Tennessee, Tennessee Department of Intellectual and Developmental Disabilities has been accredited since 2012. And this department works closely with CQL for systems change. I'll pass it on to Catherine Dunbar, who will speak more to network accreditation with CQL.
Thank you, Elizabeth. So CQL Network Accreditation is a method of defining and evaluating the quality from a person's perspective. To get that information, we use a proprietary tool called the Personal Outcome Measures. We also have conversations with people and staff and a variety of stakeholders. We take a look at the basic assurances that are in place for organizations to inform the network of where, some things to look at are that they are aware of the things to look for and to make sure that agencies are continuing to progress. It's also a strategy for identifying the priorities and objectives for CMS, state and regional authorities. And very importantly, it's a collaborative approach to external measurement of quality. We don't measure quality in a vacuum. We want to make sure that we are getting stakeholders and then using that information to the DDA system forward. Support member organizations to understand and implement performance. We provide oversight and monitoring to network members. We're available for guidance and technical assistance, things like that. We also support the network to assess the quality of life for people receiving supports. And we ensure that there's ongoing quality improvement. We do that through after a plan is written, and we'll talk more about that later. We hold DDA accountable to those quality improvement measures to ensure that agencies and people receiving services are getting the support that they need. And we also provide leadership in establishing community partnerships. Just to be very clear, our relationship is with the Maryland DDA and Liberty, the QIO. Although we will be working with agencies, our relationship primarily is with those two entities. We are going to support DDA to build capacity for quality monitoring and enhancement. Providers in Maryland are not automatically accredited. What we are accrediting is DDA's system of providing supports to people. So we gain information from providers, but we don't automatically accredit those providers. However, providers in Maryland can absolutely choose to pursue CQL accreditation if they would like to do so. So just to talk briefly about the three factors. So these are the three areas that we're going to be looking at when it comes to network accreditation. The first one is really it's about communication. It's letting agencies know what its expectations are for the implementation of a basic assurances system. So this is a quality management tool taking into consideration the factors of the basic assurances, which we will learn about in future webinars. We also want to make sure that DDA is monitoring the basic assurances and is, next slide, please. We want to make sure that the agency is monitoring basic assurances, and this is done mostly through the personal outcome measures, basic assurances information, and stakeholder feedback. The third part of network accreditation is actually integrating this information and using it to ensure that quality measures are known and acted upon. So the timeline for network accreditation, we look at network accreditation as far as the different steps you have to go through. And I'm just going to talk about these kind of broadly. We will certainly be having, more targeted information for providers in the near future. The first step to network accreditation is capacity building. And that is really what we're doing now. We're working closely with DDA and Liberty, providing training on the basic assurances and the personal outcome measures. We're also, we'll also provide technical assistance as needed. And we're going to be introducing network accreditation to different providers and answering any questions as we need to. The second step for network accreditation is regarding network evaluation and analysis. And that is about really working with the organization to see what's going on right now. What are the systems and structures that the DDA is using to discover, evaluate, remediate, and improve the quality of services across the network. Step 3 is network accreditation, which is building a plan based on our person-centered excellence and building that plan for DDA to support agencies to move forward. That will be inclusive of a variety of stakeholders. And then the last step, infrastructure, communication, and stakeholder engagement, is really about keeping the system moving, making sure that plans are followed, making sure that agencies are supported, making sure that people are getting the services that they want and need from DDA. And it looks like that there has been quite a bit of progress based on what Deputy Director Simons told us earlier today. So what's happening next? This is what everybody wants to know. So we're going to be gathering information and to really inform DDA systems about what's going well and what maybe shows some opportunities for improvement. So some of the things that we'll be doing with agencies are, we'll have a bunch of planning meetings to let everybody know what's coming up and what's happening. There will be some self-assessments going on with DDA and the network factors. We'll also be visiting with people, interviewing various stakeholders, such as people receiving services, staff, families, ISCs, agency leadership, things like that. The basic assurance reviews will also incorporate much of this information. We'll be having a lot of focus groups with various types of stakeholders. We're doing some data analysis because data inform where DDA is going to go in the future. And we will provide ongoing support to agencies and to the really need right now is for agencies to help Liberty perform some personal outcome measures and some basic assurances reviews in the upcoming months, so they can have their training. And the benefit of this is, phenomenal. You get to learn, your agency could have a more in-depth learning of the basic assurances and personal outcome measures. And you can also use that information to perhaps build upon your own agency's strategic plan. So we've learned a lot in our work with Tennessee, and we've applied that knowledge across just the fundamental things that we do. And the president and CEO of the New York Foundling, which is actually a fairly recent accredited agency, really had a lot about how accreditation really highlights areas of strengths and then helps identify opportunities. I think it's very important that we're doing this on such a large with Maryland DDA. One of the things we're often asked how families are impacted and how others are impacted by network accreditation and what they can do to help. So these are just some things that you could do as a provider or a family member or just an interested stakeholder. So first, we want to learn about the process, which is what we'll be going into greater detail as we move along. You've just heard a very high-level overview today. We want you to embrace the components of the accreditation, the network accreditation that we're doing. And two of the main components are, again, the personal outcome measures and the basic assurances. Data from these two sources will help inform, again, DDA on how to move forward. We also want you to help us spread the word. We don't want to go in, what are you doing here? What's going on? We want to share information in the best ways possible. And one of the ways that you can help us do that is by also spreading the word. And of course, CQL is always seeking feedback. We really want to know the impact that it's having on you as a stakeholder. One of the family members that has been part of a network accreditation really said this very well. We have to create the services that people need, not the other way around. We have to stop putting people into various boxes. We either underserve people or overserve them because they don't fit in the box. And we all see examples of this, very, very frequently in our line of work, where people are either underserved or overserved because the definitions are too inflexible. The definitions of the waivers or the services are too inflexible. But we'll certainly be getting more into that. For people receiving services, your part in this is very large. Also, we're going to get a lot of information from you. We'll talk to you about your life and your goals that you want to achieve. You'll work with staff to help you achieve those goals. And then the outcomes of your goals will be celebrated or will be reviewed and celebrated, because it's very important to celebrate success. Lori, one of the people supported by an agency in Iowa, really said that she liked her personal outcome measures interview. She makes sure that she shares her goals with her staff and her guardian, and she says that she's planning her own life. So to talk more about the impact on of CQL accreditation and network accreditation, Elizabeth is going to share some stories and some data with you.
Thank you, Catherine. Yeah, let's talk a little bit more about the impact of accreditation, but this time through some personal stories and some data. Now, this data, all the data that we're going to share is from our 2019 sample of personal outcome measures interviews from about just under 1,300 people with disabilities. So some of the data shows us that people choosing their own goals is key to person-centered planning. And we find that people with disabilities who choose their goals have a better overall quality of life, or more outcomes present. Okay, so in this sample, people who did not choose their goals had an average of 41% of quality of life outcomes present, whereas people who did choose their goals had 67% of quality of life outcomes present. So from the same set of data, it showed us that people who chose their goals were 2.7 times more likely to interact with others in the community, that they were 2.8 times more likely to be treated fairly, 3.1 times more likely to be respected, and people who choose their goals were 3.5 times more likely to realize their goals. Additionally, people are 14 times more likely to realize personal goals when supports are in place to help them do that. The same data showed that only 48.1% of people received supports, though, to choose their personal goals. But here's a great story of someone that was assisted in choosing and achieving personal goals. So DSP Ashley of an organization in New York supports Johnny. And Ashley had asked Johnny about some of his future goals through the use of the personal outcome measures. And Johnny expressed that he would like to obtain his driver's license. So Ashley did a number of things to support him. She set up planning sessions with Johnny. They established action steps. She supported him with driving manuals, paperwork, and courses. And they both worked on his budget so that he could start driving school. And she even attended each driving lesson with him, even on her days off. And in July 28th of 2016, he obtained his driver's license. Now, looking at the impact of people who choose where they work. Again, same 2019 data. This data shows us that impact on people's lives when they choose where they work. And this data showed us that 42% of the time people were choosing where they work, but 58% of the time people were not choosing where they work. And this has a great impact on people's lives because people who choose where they work are 2 times more likely to be respected, participate in the life of their communities, interact with other members of the community, have intimate relationships and friends, and experience continuity and security. Now, they were 3 times more likely to use their environments, exercise their rights, and realize personal goals. People who choose where they work are 4 times more likely to perform different social roles and choose personal goals, 5 times more likely to live in integrated environments, 6 times more likely to choose their services, and people who choose where they work are 8 times more likely to choose where and with whom they live. Again, just some more impact to look at here. Let's look a little more closely at work choices by the setting in which people currently are. People in competitive employment are more likely to choose than people who are working in sheltered workshops. So you can see people are much more likely to choose where they work when it's competitive employment over sheltered work or day program and activities. A great story here is that Chandra supports Rob, and he completed his personal outcomes measures or POM interview. And while staff had been so focused on his health and sleeping, Rob talked about wanting to try working again. And so Chandra supported him by helping him find and try a job cleaning offices. Well, he didn't like it. So she helped him apply for a landscaping job, a job that he knew within hours was not for him. But Grossenberg Implement was having difficulty keeping janitorial staff. And Chandra talked to the owner and secured Rob a situational trial funded by vocational rehab. And Rob is still working for Grossenberg's. He proudly tells people where he works and shows them his uniform shirt with his name on it. He is in charge of the janitorial duties for the entire shop area and the new offices. Now, network accreditation offers family and those connected to the human services system in Maryland with guidance, support, and partnership in improving quality through training, workshops, meetings, agency assessments, on-site visits, individual interviews, policy reviews, focus groups, and more. Some ways that you can get involved and help out are at the website that are on the screen, where you can learn more about the process. You can embrace those accreditation components that Catherine spoke of, and you can help spread the word. You can also connect with CQL in a variety of ways, including Facebook, YouTube, LinkedIn, and Twitter. And we have a great Facebook e-community where you can reach out to organizations that are accredited by CQL, and you can look for resources, you can ask questions. It's just a great supportive community of CQL accredited organizations. So are there, do we have any questions?
Oh, yes, I can take a shot at the second one. And that question is, will interviews occur with provider agencies and CCS agencies as part of the process? The answer to that question is yes. We'll definitely be having stakeholder meetings and getting feedback from provider agencies. That's a part of the central part of what we're doing is we have to make sure what is working and what may not be working for providers. And of course, that goes for the case coordination agencies also. Another question was, does CQL provide assessments for assistive technology? No. We do not currently assess for assistive technologies. We leave that up to the agency. However, we could give feedback on assessments, for agencies that would need that for assistive technology. I'm sorry, I'm reading and talking at the same time, and that's never a good idea. We could certainly, provide some resources and things like that to agencies that may be wanting to come up with an assistive technology assessment.
And Catherine,
someone else.
Catherine, that may be something too, where somebody may want to check out our e-community, as there may be organizations, people on there that have something that they use or have a way to access something that would be helpful.
Thank you. That was a great add-in. So someone asked where were we? Jennifer, if you want to take that answer, I can answer it in the short form. But if you want to answer it in a longer form,
sure,
that would be great.
Sure. So Liberty Healthcare Corporation is the entity that was awarded the Quality Improvement Organization contract that DDA recently put out last year for bid, and Liberty was able to secure that contract. So we'll be doing quite a few things for the department over the next 4 to 5 years. One of those is supporting the data collection for network accreditation with CQL. So Liberty staff will be trained in the personal outcome measure as well as the basic assurance reviews. So we'll be on site at provider agencies, talking with people, reviewing policies and procedures, all of the things that Catherine and Elizabeth talked about as part of the webinar today will be the data collectors for that. The QIO is also supporting the department with other evaluation activities around utilization review, targeted case management reviews, things of that nature. So that's who Liberty is, in case you guys have further questions.
Thank you, Jennifer. Someone also wanted to know what a typical time frame is for accreditation. And since I'm not exactly sure if you're talking about agency accreditation or network accreditation, I'll answer both. For network accreditation, it takes a few years because there's a lot of capacity building in the training of DDA and Liberty staff. There's a lot of information gathering and information sharing. A lot of opportunities to get feedback from people we chatted about before, so various stakeholders that of course would include providers and people receiving services. It would also include direct support professionals, frontline managers, families, case coordinators, pretty much anyone with a vested interest in the system, the DDA system, we would try to have a focus group with. So that takes several years. As far as an agency, accreditation could, we ask agencies to start a self-assessment about 4 to 6 months ahead of time, just so there's lots of room, to answer questions and to really self-reflect on the agency and its policies and procedures. Also, our schedule fills up really quickly. So it's, trying to make sure that we get the dates that work for you for accreditation. So I would say, as much time as clearly, the minimum time frame I would say is for a first time agency is 3 months. Accreditation lasts from 3 to 4 years, depending on the type of accreditation is seeking. For network accreditation is 4 years. If you need more specifics, feel free to type another question into the Q&A or just contact us directly. We'd be delighted to talk to you. Being more specific timeframes for when the process will start and potentially wrap up. Technically, we have started the process. We're doing the capacity building. And we can certainly get you more information around timeframes. It's a 3 to 4 year process. So depending on how the capacity building goes, that usually takes the longest. And providers, agencies, everybody really, other stakeholders will become much more involved. Spring of next year, I would say, we'll be offering lots of opportunity to learn about our tools and to engage with us regarding information gathering. Someone had a question around policy review. And will provider policies be reviewed to assess consistency with CQL standards? And if so, how would the process work? So that's a great question. The agencies that are going to be part of the information gathering sample, we do a 25% sample every year, Liberty and DDA will be doing that sample, and CQL, of course, will help them figure out that sample. Part of the basic assurances review is to look at policy. We look at 2 things specifically for basic assurances. One of those is the system, which typically is a policy procedure. It could be training, it could be a form, it could be, a variety of things. Typically, it's something that is written down. So that will, carry on through the rest. So yes, those policies will be reviewed to be, if you will, basic assurances standards. I want to stress that we are looking at the basic assurances. We are not looking at the waiver assurances that Maryland will have to follow, although there will be certainly some, the word I'm trying to say, but there will definitely be some between those two, because the basic assurances and personal outcome measures align closely with the HCBS waiver standards. The process works by a policy or procedure, or whatever that system is, deciding how well it aligns with the basic assurances, giving feedback regarding where you could go with that policy to make it align better. So, give you some kudos when the policy is quite good. Are there similar statistics showing the difference between providers that are? The answer to that is no, because we do not have access to information regarding non-accredited providers. So, unfortunately, we don't have access to that information. However, states, may have some writers, they may have that information. We are just not privy to it. Is there a plan from DDA to require Maryland agencies to become accredited? That I do not know the answer to, so I would have to ask Mr. Simons, or someone else from DDA would be able to answer that question.
Yeah, this is Bernie. I can answer that. No, we are not going to mandate or require that individual providers have their own accreditation. It's one of the reasons why we went forward with network accreditation, in order to strengthen our system.
Thank you for that. Do we align with CARF accreditation? Never having done a CARF accreditation, I can't answer that specifically. However, I can tell you that one of the major differences that agencies have shared with us is that, well, several differences include, we spend a lot of time with people receiving services and staff. We spend a lot of time with people in general. We also, of course, look at policies, procedures, paper, all that stuff. However, most of our time is spent visiting with people and chatting with them about how everything is going at the organization. We also take a partnership approach to accreditation. So once we accredit an agency, we meet with that agency once or twice during their accreditation cycle, and check up to see how agencies are doing with what their plans are. We provide resources, our staff are available whenever an agency has questions. We make connections with other agencies that may want some resources, or to chat with similar agencies about how things are going with them. And we have hundreds of free webinars and articles and resources on our website for agencies to use regardless of accreditation status with CQL. What type of data will be collected from provider agencies and how? Good question. Most of the data will come from the personal outcome measures and the basic assurances. So that is to inform the network regarding what the system can do to move forward. So that's a lot of information. We look at a lot of different data points within an organization. And the thing that I want people to to know is that we do not expect perfection of an agency. So we're not going to expect Maryland DDA to be perfect. We expect progress from agencies, and some of that from providers around the basic assurances and personal outcome measures will certainly do that. So as an agency who is partnered with Liberty to be a spot to have a basic assurance training, or to provide people receiving services, provide opportunities for them to have a personal outcome measure interview by Liberty staff. You're going to get a lot of information from that. And however, it's just an agency that is having a basic assurance. You are not, at this point at least, but you are not going to be held accountable for those things that you don't have in alignment with the basic assurances. Be given that information, but unless you're going to become expectation for alignment. However, with that information informing the system, Maryland may have expectations based on, some trends within agencies, to better align. I hope that answers your question. That was kind of a long answer. So as a DVA provider and as an organization that definitely wants to pursue this, what action steps should we be doing? This, I assume, is accreditation. And we would be delighted to chat with you about that. The first thing you can do is go on our website, and you can email RFE at the council or info at the council, and get, we can set up a meeting you're at and where you want to be, and what you want to see in the future. And then we can certainly walk you through the process of implementation. As services expand, they will require more resources, will to assure that the goal of person-centered excellence is properly funded. Across our industry remains the number one obstacle to excelling in our craft. I'm going to let someone else take this question. It is of a network accreditation to conduct a feasibility. Certainly, if one is conducted, we would certainly give feedback on that survey and how it could help direct the DDA system moving forward. So I don't know if Bernie is prepared to answer that question, and answer in the future.
Yeah, I am. I think that the information that you would be gathering would complement information that we are doing with our rate advisory group. We met this year for the first year. Many of you know that we've got about 10 different entities on that, from Max, people who are self-directing their services, non-Max members, etc., to look at our rates and the adequacy of the rates. And so, as we continue to move, this would be another avenue to inform that.
Okay, thank you. Okay, will all agencies be part of the sample at some point in the process? Yes. We will do a 20, and well, I can say yes, but things do change. There will be some agencies that fall off, some new agencies that come on. The goal is for eventually all of them to be part of the process, which is why we do a 25% sample every year. So over, the life of the accreditation, every agency would be part of that. It's also a little it takes quite a bit of work to make, for example, for all 4 years. So the person that we have working on that is quite brilliant, and she does it very often for agencies. So I'm sure that to do that with Dr. Friedman. Providers to obtain accreditation, yes, there is based on a lot of different factors. One of those factors is, or some of those are the size of your agencies, geographically diverse it is, how many service lines you provide, and that about covers it. So you could certainly, take a look at our website. For first-time agencies, the accreditation option is for basic assurances or quality assurances accreditation. Agencies who've not been through quality assurances accreditation really don't meet the eligibility requirements for person-centered excellence or person-centered excellence with distinction. But you can certainly email info at the council and we can get you more specific answers to your questions. The other thing about costs is that those costs are from the accreditation term. So not everything is, we don't bill for any activity that hasn't occurred. So when you're having your second or third visit, then we would bill you for those activities when they occurred, not at the beginning. What about agencies that are already CQL accredited? I think I might need more information about that question, but I can attempt to answer that. So agencies that are already CQL accredited, so typically what we do in Tennessee is if an agency is accredited, that information regarding the basic assurances is shared with the state. So we would do the same thing in Maryland, depending how long ago that was. So let's say you were accredited in 2020. That information isn't going to be as relevant in 2023 as it was in 2020. So we would certainly work with you and your agency regarding that information and see how the best way to handle that. Another cost question, I answered that. Sorry, I'm just trying to read here. Has Liberty started to reach out to providers and people receiving services in Maryland, and how will their staff identify themselves? So Jennifer, I'm going to let you take that question.
Sure. So we have reached out to several agencies as we have been training our team with CQL on the personal outcome measure in particular. We've reached out through webinars and email blasts to see if there have been providers or people that would like to participate in those practice interviews. So we've had many providers that have joined us to help us coordinate interviews with people they support, which has been extremely helpful. We are still doing that process right now. So it takes several weeks for the team members to be trained, to practice the personal outcome measures, get good enough where they would be passing inter-rater reliability, and then be able to be certified through CQL as PALM interviewers. And so throughout that process, the next couple of months, we'll be continuing to do that, as well as then move into doing the basic assurance reviews as well. And so all of that will be volunteering through agencies and people supported that would like to participate in those. We have not started the official rollout of doing the sampling and connecting with providers, and people supported to say that they've been selected to participate in that particular time period. That rollout will happen later this spring, and there will be information shared in advance of how that process will work and how we will be reaching out. So we will probably be reaching out more through formalized letters and emails, as well as phone calls, before we would be coordinating and coming on site.
Thank you, Jennifer.
You're welcome.
Let's do them very quickly. Who else is CQL currently working with other than DDA and piloting this project? In other words, is OCHQ involved in this project as well? So I did a quick Google search to find out what it was, which is the Office of Healthcare Quality. And it looks like, just from a quick overview of your website, it looks like you're doing, the OHCQ looks at medical providers, so hospitals, maybe nursing homes. So no, CQL does not work with hospitals or, physician clinic. We do, social services. If that doesn't answer your question, feel free to shoot me an email. I'll try to answer it more in depth.
Catherine,
This
I
is-
And
I
then
can jump in.
the last,
Okay.
yes. Oh, perfect. Thank you. Thank you. Go ahead.
The Office of Healthcare Quality, they support incident investigation for people receiving services through DDA. So in that way,
Okay.
they would be open to hearing information about CQL and the practices and principles of that. I think that's a really great idea, because then they'll understand from a new perspective why it's so important for people to connect with their personal outcomes and what that process looks like.
Perfect.
Because they also do licensing of provider agencies as well. And so it would be important that they were part of the process.
Okay. Thank you, Jennifer.
You're
Appreciate that. The last question is about redundancies and alternate redundancies to avoid system failures. Yes, we do look at Maryland's kind of policies and procedures around how they're doing business. So we would, if you have a provider manual, we'll be looking at that, and we'll be looking at different policies and procedures that the department does. And one of the things that we would look for is both redundancies to avoid system failure, but also redundancies in surveys to providers. So if if the QIO is coming in and gathering information, can they share some of that information with other entities such as OHCQ, and that way a provider isn't being over surveyed, which tends to happen in a lot of states. So, sharing information among different departments is also something that typically needs to be worked on with a system such as Maryland DDA. Not because it was anything intentional that DDA said that you had to have another survey. I think sometimes it's just a lot of legacy things that are in surveys that have been accounted for, and other tools that the state uses to monitor agencies.